Hello everybody, welcome to this podcast, the first of our series hosted by Equi, which is a think tank that draws on British Muslim insight to address pressing issues that we face in the UK. My name is Dr. Mary Hunter and I'm the senior researcher at Equi. And as our name suggests, we were created in order to help make the UK a more fair and just society. And in order to do this, we give British Muslims a voice in policy making. And our work is primarily research driven. We look to do research on different issues affecting society and look at how British Muslim individuals, organisations and charities are responding to them. And these are issues that affect everyone, from healthcare to justice, education to culture. And in the short time that we began our work in 2024, Equi has published 11 reports and we're glad to be launching our 12th one today. And through this research, we've found that British Muslims make a significant contribution to the UK, and this should be supported in order to benefit everyone. This is because these contributions positively impact Muslims and non-Muslims alike. And so our policy recommendations are practical things that policymakers can do in order to maximise the support in order to realise the positive contributions across society. And today we're thrilled to launch our latest report called Young Minds, Better Care, Faith Literate Support for Young People's Mental Health. Through research, including interviews with over 30 experts in the field and also national polling, the report highlights the contributions of British Muslim-led charities in supporting the mental health of young people. 6 of these charities were found to have reached at least 224,000 people and to have saved the NHS an estimated £95 million. And joining me today to discuss this topic is the lead researcher of the report from the Equi team, Taibah Al-Fagih. Taibah conducted the research for the report, during which she interviewed the experts and analysed key documents about mental health provision in the UK and the need for faith-sensitive services in the sector. In the time since she's joined Equi, in addition to this report, Taibah co-authored a report on British Muslim charitable giving, and like all Equi reports, you can read this on our website at www.equi.org.uk. And in conversation with Taibah and me today is an expert on faith-sensitive mental health. Dr. Rachel Abedi is the founder of the Reflection Project, which seeks to ensure that every child in the UK feels heard and can access faith-sensitive therapy. Initiatives spearheaded by the Reflection Project include free in-person therapy for children and young people aged 2 to 25 in London, parent work, and conferences that bring together practitioners, researchers, and community members to explore faith sensitivity in mental health care for young people. Dr. Abedi's expertise stems from her work as an ACP registered child and adolescent psychotherapist with experience in the NHS Child and Adolescent Mental Health Service. She is also a lecturer at the Tavistock and Portman NHS Trust, where she supervises doctoral research. Welcome to you both and thank you for joining me today. So first I'd like to begin by asking Taibah to kick things off. Could you explain why the report is needed and also share its key findings as the lead researcher?
Thank you, Mary. This report is really, really important. It comes at a really important time. In 2023, 1 in 5 young people aged 8 to 25 had a mental health, probable mental disorder. And the cost of this in England alone in 2022 was £300 billion. For young people under 20, this cost was £18.8 billion. And so you can imagine for the UK as a whole, that is much higher. This cost is obviously not just financial, it's also social, it's also in terms of the future of this budding generation, which has been called by experts as being risked as a lost generation due to these costs. Now, statutory services are often overstretched and they're struggling to meet this need. And in a recent independent review of the NHS, mental health was identified as a key concern. Waiting times often stretch beyond a year, which is a really, really long time for young people at such a tumultuous time in their lives. And so the findings of this report come at a really important time. I'll just draw out 3 key points which I thought were really striking and which draw out the key role that faith communities are already playing in supporting young people's mental health. The first thing that we found was that faith can be a really powerful protective factor for young people. It can provide meaning, it provides belonging, it provides strength, it helps them make sense of difficulties and cope with stress, and also reduce anxiety over things like death, and act as a protective factor for things like suicide or self-harm. When we polled 1,200 young people between the ages of 16 to 24, 4 in 5 of them told us that they used faith-based, spiritual or reflective practices to deal with stress and other issues. And this just shows us how faith and spirituality can play a role across the board for young people in dealing with difficulties and navigating such a stressful time in their lives. 73% of all of those people who we polled with a faith told us that their faith was a source of strength and belonging in difficult times. So faith can be a really powerful protective factor, and that was the core finding that came out above all. The second thing that we looked at was, as you mentioned, 6 faith-led charities, and we found that they reached over 224,000 young people across the UK, which we estimated saves the NHS over £95 million in costs. They provide holistic and preventative support, which means that they reach young people long before things can escalate into crisis, saving costs for the NHS, as I mentioned, but also acting as early intervention and helping these young people where it really counts. Another really important finding that we found was the level of trust that these young people had in their faith communities. So faith leaders and faith-based organisations are really important pillars of support, and we found that young British Muslims who answered our polling were more likely to, or had more of them had spoken to a person who would give faith-based advice than someone who wouldn't. We also found that 2/3 of those British Muslims felt confident that they could go to their faith community if they were struggling. At the same time, our research also showed that there's a really significant opportunity for mainstream services to engage more effectively with this reality of faith as a source of support. So many practitioners that we spoke to told us that they know that faith can be an important part of a young person's identity, but they're not sure how to approach that, or they don't feel confident enough to approach that. Our polling also reflects this. So 40% of those young people aged 16 to 24 told us that they would have been more likely to have sought help earlier if they felt that the mainstream services understood their needs and their faith identity better. So overall, there's a key opportunity here. We understand that faith is a really powerful protective factor and a source of support. And so by improving faith literacy and building stronger partnerships with faith organisations and faith leaders across the UK, we can expand access to support, we can reach young people earlier, and have a more preventative approach to mental health care.
And Dr. Abedi, do you find that these findings resonate with your experience in the sector?
Yes, I think absolutely. I'm particularly struck by 2 aspects. One is the findings about the significance of faith identity, which I think, in my experience of being trained and then training others in NHS child psychotherapy services, faith is often overlooked. If you're lucky, it might be treated as some sort of subset of culture, but actually the deep significance of it is not really explored in trainings. And of course, we're not saying that it's significant, that faith is significant in the same way for every child and young person. The individual is, one has to meet the individual where they are. But I think so often it's ignored, and maybe it's because of what Taibah was saying about services not knowing how to approach the faith aspect. But what it then means is that young people often just will not, if they do get as far as mainstream mental health support, they won't mention things to do with their faith, because there's this anticipation of not being understood, or worse, that they might be judged. So then comes to my second point about trust, that yes, there is this sort of, we're seeing that families and young people whom we work with talk about being able to trust someone who they think gets Muslim faith identity. Doesn't mean we all think the same about everything to do with the faith, but there's something about an experience of judgment and prejudice that many Muslim families and young people experience and an anticipation of that if they go to mainstream services.
And as Taibah alluded to, our research shows that 40% of young people would have sought help earlier if they felt services better understood their faith background. So, Dr. Abedi, what are the dangers of young people delaying or avoiding seeking help for mental health issues?
I suppose, as with any health issue, when people don't seek help, there's a danger that what might have been quite a manageable condition or situation or experience will get worse. And potentially it's not necessarily that things are diagnosed. Sometimes there is something to diagnose, but sometimes it's not that. But there is, if we're talking about different levels of anxiety, for example, if you get some support with that early on, it can help keep it manageable. And then, of course, things can become really quite debilitating if left unsupported. I'm trying to avoid, in a way, the sort of medical language of untreated, because, yes, for some things there are medical treatments, but a lot of what we do is about supporting, being alongside the young person in difficult experiences. And, of course, so these sort of unsupported conditions, if you like, mental health states, can lead to really significant physical and further psychological symptoms, loneliness, family breakdown, missing school, college, not being able to work. I mean, really, the implications are very serious. And in worst case scenarios, you're talking about real isolation, potentially incarceration, and in some cases, loss of life.
Yeah. What I found quite surprising as well about the national polling that we commissioned at Equi showed the importance that was placed on faith in the context of mental health for people more broadly and not just specifically British Muslims. So 60% of young people aged 16 to 24 from all or no faith backgrounds agree that they would like to see more mental health services that understand or apply faith-sensitive approaches. So Taibah, was there anything else that you found especially surprising in terms of your findings?
Yeah, I was really struck by that particular statistic as well. One thing that really stood out to me was just how universal these conversations are, like you mentioned. So although our report focuses on young British Muslims and British Muslim organisations, a lot of the practitioners we spoke to told us that faith-sensitive support isn't necessarily just limited to people of a faith background or just one community in particular. For any young person, whether they identify strongly with the faith or they're still exploring their beliefs, or they just have a very various different layers and intersectionality to their identity, these issues often come up when they're struggling with their mental health. And so it's important for practitioners and for services to recognise that. Faith is important in the everyday life of over half of the people that we polled. So that's over 50% of young people aged 16 to 24 in the UK. That is a significant portion. And so what we found is that by centering a patient-centred, a more personalised, a more tailored approach, a more holistic approach to mental health care for young people, you're not just supporting those who are Muslim or of a specific faith, but you're inviting all aspects of someone's identity to be a part of that healing journey. Another thing that we found that was really, really interesting was how much preventative work is being done within faith communities across the UK. And this doesn't necessarily have to look like counselling sessions or therapy sessions. It can often be activities like mentoring, career support, sports activities, and other social activities which prevent, issues like loneliness or economic instability as well. That kind of early community-based support can play a really, really important role in helping young people build resilience, find their communities, and also seek help earlier through trusted adults. The final thing that I was really struck by in the report itself was just how many resources actually exist in the NHS that are perhaps underutilised, which can help in providing more faith-sensitive and faith-literate support. So I'm thinking about spiritual care teams, chaplaincies, lived experience practitioners, people who can really offer different perspectives and allow young people to really tap into their faith as part of a more holistic healing journey. Unfortunately, some of these resources aren't utilised enough due to maybe a lack of awareness or a lack of available resources like funding or posts, but they are a really, really, they're a gold mine that are underused. And so that really struck me in the report as well, is that we have these resources available. It's just about making the most of these. And so with the right training, with the right support and the right collaboration between services and communities, there's a really strong opportunity here to build mental health support that is more holistic and gets to young people earlier and helps build a generation, for the future.
And I think with regards to my next question, both of you have sort of touched on it already, which is this importance of prevention. And a positive change, at least in mental health care in the UK, is this shift towards focusing on prevention rather than sort of just dealing with health problems as and when they arise. And Equi's research found that faith-based and community organisations often support young people of all faiths and none long before they actually reach that crisis point. So, Dr. Abedi, in your experience, what do faith-based organisations do, and what could the NHS actually learn from them?
I think we understand the benefits of holistic, long-term approaches to support, and understanding the young person in the context that they live in. So we found it really important in our service that when we meet the young person where they are, we go into the community to meet them, and we perhaps meet them in school or in a local mosque or in a community centre. There's something about being part of the community that the young person knows and trusts. And of course, the Muslim identity in this country, it's not a homogenous one. There's a huge variety in terms of age, ethnicity, experiences, understanding, and levels of how they incorporate faith as part of their life. So it's really important to not make assumptions about what that means to be a Muslim. Mm-hmm. It's very, very important. And I think in terms of what the NHS could learn from this sort of approach, I think there's three things really. One, I would say, is being aware that these young people so often have had experiences where they have felt excluded or marginalised or not understood. And so being aware that we're all sort of part of that as well. So what can we do in our own organisation or trainings, for example, where we acknowledge that and we really examine ourselves and what assumptions are we making about these young people? And I think there's something about that bit of work of challenging the assumptions that we make, because we all make assumptions all the time, every day. It's part of how humans work. And we need to some extent, but to challenge that a little bit. And then thirdly, really to reach out and get some support and some advice if you're not sure about how to incorporate sort of faith literate or faith sensitive approach. And there are we offer support in that. There are other organisations as well that could offer, whether it's a supervision over a particular case or training for an organisation. There is support out there. Yeah.
And I think this is one of the major thrusts of our work at Equi, is trying to show actually across different sections of society, different issues, you actually just have to be willing to have the conversation with experts, British Muslim experts who can actually inform kind of faith literate policies. And one of the most important things that we try to do at Equi is make policy recommendations to policymakers. So Taibah, I wanted to ask what the key recommendations that came out of this research were.
Yeah, you're right, Mary. That's a really important part of the report, because, as you mentioned, one of our key aims at Equi is not just to highlight some of the challenges or the issues that are being faced, but also highlight practical solutions and what we can learn from faith-based organisations like Dr. Abedi kindly mentioned. Our recommendations for this report fell into sort of three key areas. I would say the first is recognising the role of faith, and then equipping the system or equipping practitioners to be able to respond to it. And the third would be investing in what already works. So recognizing the role of faith was the first key sort of theme in the recommendations that we made. We have spoken about how faith can be such a powerful protective factor for young people. We have shown how faith-based organizations are already trusted, accessible places for young people. And so we are recommending that the Department for Health and Social Care and the NHS more clearly recognise both faith as a protective factor, but also recognise faith-based organisations as partners in providing that holistic and faith-literate care, which can then help us achieve prevention and early intervention. We also recommend that national guidance for practitioners specifically to do with mental health recognises the role of faith within assessments and within care plans in a way that's appropriate for the young person. The second element was equipping services and practitioners to deal with faith effectively, right? So delivering faith-literate care in practice looks like encouraging local systems. You've got integrated care boards and integrated care partnerships within the NHS. They should be treating faith-literate care as a priority. And this is especially the case in areas where there are key gaps in access, maybe lower levels of trust in statutory services from parents, from schools. And so working with schools, working with places of worship like mosques or religious hubs, youth groups, organizations like the Reflection Project to really tap into existing networks that young people already trust, so that they can access help earlier and move more smoothly between different sources of support. The third element of what we recommended was investing in what already works, and that includes investing in training and building confidence. So we recommend developing practical training for practitioners and for all frontline staff that are supporting young people with mental health on a daily basis, to encourage them to engage with faith appropriately. And that looks like, for example, how to have conversations about faith, how to recognize when it's actually a source of support, how to recognize when maybe it's not a source of support, and as well as how to make safe referrals to trusted, appropriate organizations which might be better placed to give them the support that they need. Importantly, we think this training or this knowledge exchange should be reciprocal. So there's so much that the NHS and that CAMHS and the young people's mental health services offer, and there's so much that faith-based organisations and community organisations can also offer and learn from each other. And so this idea of reciprocal training, where each learns from the other's expertise and knowledge and insights from within the community or within the system that can benefit the other, to work together more effectively. In terms of investing in prevention and in evidence, in the NHS and in all approaches, evidence serves as a key base for how different approaches are formed. And so if we don't have evidence on how faith-literate approaches are effective, or we don't have substantial investment in different research projects on how this can be an effective way of supporting young people, then we won't be able to sort of push for those approaches. So we're calling for more investment and more research into how faith impacts access, how it impacts experiences within mental health services, and also outcomes for young people. It also means investing in the existing infrastructure that I mentioned earlier, so spiritual care teams, chaplaincies, peer support networks, and making sure that they're equipped to play that important role that they can play within the holistic care that we can provide for young people. And if we do all of this together, that we can build a more preventative, a more holistic and more collaborative mental health system, which is one where we can work alongside communities, we can work alongside faith leaders, and recognise the role of faith where it really matters. And ultimately this helps everyone. It will improve access, it will improve outcomes, and it will address key health inequalities across the country.
So, Dr. Abedi, if there is a young person watching who belongs to a specific faith and feels that plays an important role in their mental health, what can they do in order to find the support that they feel they need for their mental health issues?
I mean, it's a really good question. While there are some organisations that are specifically out there to support young people with their mental health in a sort of faith-sensitive way, it's really tough finding them sometimes, and there's a real gap. There's Muslim Youth Helpline, which it's anyone can reach out to them, but it's sort of different from ongoing mental health support. But you can find out. You can be. Sorry. Okay. So there's Muslim Youth Helpline, which anyone can call or contact online. But in terms of longer-term mental health treatment or support, there's quite a gap. I would go online and check for the services that exist. There are quite a lot for age 16 plus that work in a faith-sensitive way. We work with younger children as well, but at the moment only in London. There's quite a lot of advice online as well, but I'd be careful as well about the source of the advice. The trouble is, it's a whole issue with mental health support that usually the families don't know what to look for in terms of a properly trained, accredited therapist. Because there's no law, unlike in America, for example, there's no law here that stops you saying that I'm a counsellor, I'm a special therapist for children.
No, like, special
you can do it, and you've had a
need.
6-week course somewhere. Now, so it's not like clinical psychology, which is like a protected profession. So actually, we have to be quite careful when we're saying, just go online and choose something. You know, there are organisations where they do check the qualifications and so on of the therapists. Ours are all on NHS-based trainings or have qualified already. But there's also a kind of growing field of Islamic psychology, and that varies in terms of how people are accredited, how much experience they've had, whether or not they're specifically trained to work with children.
No, that gap is really what this report seeks to address. I mean, all young people everywhere should have a chance for mental health support that is tailored to them and holistic. And if young people of faith or of a Muslim background are unable to have that, then that is a really, really important gap that the government needs to address. So whether that's, uplifting and encouraging faith-based organisations like the Muslim Youth Helpline, like the Reflection Project, but also equipping practitioners who are accredited, who are trained, who understand how to work with children, to slightly widen their worldview and understand that, faith can be really important for some of these young people, and it can be conducive sometimes to their healing.
Absolutely. And I'd say also, conversely, that the learning and the connection to sort of the understanding in terms of classical Islamic knowledge, there's a lot that the NHS trainings can learn from that as well. So it's a kind of mutually beneficial relationship potentially.
Weren't the world's first mental health hospitals were in Baghdad or in Cairo in the Islamic Golden Age, which it's a really strong heritage that we can learn from in the Islamic tradition that can benefit not just Muslims but everyone across the UK.
Absolutely. There's some. Have you seen the Muslim census report that came out just recently called "The Crisis of Belonging"?
I did see about it. Yeah.
So, one of the major findings on that was the degree of financial hardship amongst the Muslim population in the UK. But of those, they polled about 5,000 people. 95% of those who said they were in financial hardship did not ask for help. So it's interesting because it echoes a little bit what we're hearing about Muslims not asking for help for various reasons if they have mental health difficulties. But that combined with 2/3 of the young people, of the people they polled, 2/3 of the young people they polled said that they felt quite negative about their future in the UK. Now, both of those things have an impact on mental health.
Of course.
Whether you feel you belong, whether you have enough enough money to get by from day to day and have a place where you can live and raise your children. Those things all have an impact on mental health. But I realise that we didn't really sort of mention it. And I guess it's relevant because a lot of these services that are available, which are faith-sensitive services, are paid-for services. And while it's great that they're there, the gap is particularly for children and for free services for young people to support their mental health. And it's relevant not just for Muslims, obviously, but I think it's interesting, the connection that the Muslim Census report made. That there's a particular issue. It's intersectional, like you said. It's intersectional with financial difficulties, with racism, with sort of anti-Muslim prejudice.
Yeah, absolutely. I mean, in a post-COVID world, this particular generation had some of their most formative years, in isolation or, in lockdown. And that has had, a really big impact on their mental health, combined with the financial, difficulties that a lot of people across the UK are facing at the moment. I would say that, the faith-based organisations, the voluntary-led organisations, people within the voluntary sector are addressing that key gap with the little resources that they have, and providing that free care, that informal support, formal and informal, whether it's through counselling and therapy sessions, or like I mentioned, through, free sports sessions, lunch provided, or, CV sessions, or essay help, all these different types of things that address some of the root causes of, ill mental health in the UK for young people. And as you mentioned, which aren't just limited to Muslims. So while the organisations might be operating off of, values that their faith teaches them, a lot of the time they are frequented by, people of all faiths and none, young people of all faiths and none, who are able to access these services and benefit, and have that holistic environment in which they can really grow and thrive. And so I think that faith-based organisations are playing a role in addressing that key gap there. But they just need that step up from the government to ensure that every young person across the UK is accessing the mental health support that they need, regardless of where they live, or what financial situation they're in, or what faith background they're from.
Absolutely.
And I think when it comes to policy recommendations as well, it's really key that we listen to subject matter experts and practitioners. So we're very grateful that Dr. Abedi is with us today. And I wondered, is there one thing in particular that you would like to see government doing differently, if you can narrow it down to one?
I suppose the word collaboration is really important, because that encompasses the reciprocity that you were mentioning. For example, we have an NHS-funded doctoral trainee on 4-year placement with us in a community charity, community organisation, and that's brilliant for our learning, for their learning. It's a great example of what one can do. Faith-led organisations shouldn't be doing their work in a silo. It's about, I think, collaboration, so that we can sort of share insights, share kind of leadership on research, and foster best practice across services.
And so as we come to the end of our conversation, I kind of like to highlight a few of the key points that were mentioned. Very much the importance of faith literacy within our institutions, and as both Taibah and Dr. Abedi have said, the importance of collaboration between community members, between governments, between healthcare services, and that's in order to benefit wider society. And this requires kind of understanding young people as individuals and as people who are influenced by faith, but not in a sort of homogenous way where everyone within the British Muslim community is the same or has the same experiences. Every young person is different, and I think these were sort of the key points that came out of the report and the discussion. So to sum up, there's a strong call here for government to recognise faith as a protective factor in youth mental health, to equip healthcare providers to give faith literate support, and also invest in research that prioritises the prevention of mental health issues. Thank you so much to our speakers today, to Dr. Rachel Abedi from the Reflection Project, and also to our team researcher from Equi, Taibah Al-Fagih. We look forward to welcoming you to our next podcast. The report is out now, so please take a look at that on our website, and we'll also be sharing our future reports and future podcasts on our social media handles, so please do follow us on LinkedIn, Instagram and YouTube. Bye for now.